I really, really love this topic, Gary. Everything you need to know about increasing case acceptance. I think you are one of the best in the world, if not the best in the world, on this topic. And the reason I'm saying that is, I have heard, dozens and dozens of your clients, those who learned from you over the last 44 years, say like, you not only like teach them skills, but you help them think differently. So I'm really, really excited about our episode. But, I had a thought, if it's okay with you, Gary. Um, you know, everyone is different, right? So they're going to get a lot of wisdom today about, how to improve case acceptance, tactics, strategies, et cetera, et cetera. But, coaching is very personalized, and some people need personalized help. And the good news is just a single case, let's say a $30,000 case or even a $10,000 case, you do 6 of them a year, 12 of them a year, it changes your life. I mean, it literally 80% of that extra revenue goes into your bottom line. So the ROI is massive, the return on investment. So I strongly would suggest, Gary, if it's okay with you, that people need personalized help on case acceptance, they should book a coaching strategy meeting. What do you think?
Yeah, that's something that is a key competency among thriving dentists is they have developed successful case presentation strategies, techniques, and ways of helping their patients want ideal care. And that's one of my strong suits, a passion of mine. And of course, it's always customized to the practice on depending on what your goals are in terms of case type, what kind of dentistry you like to do, all of that. And there's not a one size fits all. It's really it's also adapted to the doctor's personality. Are you more extroverted? Are you more introverted? And all of that has to do with presenting dentistry in a model that's true to you. I'm not going to give you a generic script to present dentistry because that doesn't work in my opinion. People can read through that in a heartbeat. It's the way to present it in such a way that's true to you and that fits your style. And it feels like you're putting on that old pair of jeans, Naren, that jeans that's been in your closet for 20 years and they're your go-to pair every time you put on, you decide to put on a pair of jeans and they feel perfectly comfortable because they're broken in, they're fit to you. Well, same thing with case acceptance. Got to figure out a way to make it true to you. So yeah, would love to talk to any of our listeners about that and customize this to have it work for you. Schedule a coaching strategy meeting.
Thank you, Gary.
What website is the link for that?
Yeah, it's thrivingdentist.com/CSM. Thrivingdentist.com/CSM. Without further ado, let's jump in. Let's, talk about everything that a dental practice owner needs to know about increasing case acceptance.
Well, let's start by addressing something that maybe you've never considered. And that is the model that you were taught to present dentistry in dental school is fatally flawed. It's fatally flawed. It's taught in every dental school and it's flawed. Here's the model. Identify a problem, present a solution. Identify a problem, present a solution. That's how case presentation is presented in every dental school in the United States. There's currently 67 dental schools in the US, Naren. All 67 dental schools teach that same concept, every one of them. Find a problem, present a solution. And the problem with that is you have no idea if the patient has any interest in that. And if you're presenting something that they have no interest in, guess what your case acceptance is going to be?
Not very high.
Pretty low. So let's talk about a different model that can be adapted. I know why they teach that in dental school because that's the old school way of doing it. However, there's a better way.
It's like a mechanic, right? It's like a problem solution.
Yeah, it's a problem solution. Yeah. Hey, your car's leaking oil. Here's what we do about it.
Yeah.
And the part with dentistry though is you have to have the patient have an interest in a solution.
No, I think the difference between a car mechanic and a dentist is, of course, if they're in pain, they're going to get it done. Just like, the car, if you don't change the oil, it's going to freeze the engine, they'll get it done. But in dentistry, a lot of that is not like if you don't do something today, you're not going to die tomorrow, right? There's no
Well, let's
significant
benchmark it.
consequence.
Let's benchmark it. And I benchmark it in three categories of dentistry. Now,
Mhm.
there's probably more than these three, but I think it's fair to say that almost everything you'd present would fall into one of these three
Right.
categories. Category one would be necessary dentistry. The patient is in pain. What
Mhm.
should your case acceptance be when the patient is presenting in your office in pain? I'm going to say that anything less than 100% is not acceptable. When the
Right.
patient's showing up in pain, and you can say to the patient, Naren, I'm sorry you're experiencing that. Your cheek's swollen out here. You've told me that you haven't slept in 3 nights. I'm sorry you're experiencing that. Um, and let me share with you what we can do to stop that pain. Would that be okay with you? And you're going to nod your head, yes, please. So necessary dentistry, the patient's in pain. Case acceptance should be 100%. Now let's talk about the second category. This is asymptomatic general dentistry. Asymptomatic. It's not symptomatic. They're not in pain. A classic example of that would be old amalgam fillings that are failing clearly by every way you look at those, by visual inspection, by radiographic inspection, by photographic evidence. They are failing. But guess what? They don't hurt.
Right.
My suggestion is case acceptance for asymptomatic general dentistry. Our goal is 70% or above. It's not 100% because some people will say, doctor, I'm only going to have this done when it breaks, or I'm only going to have this done when it hurts. And you just, you can't impose your
Can
values
you give me
on
an
the patient.
example of that, Gary?
Old amalgam fillings.
Okay.
Those old amalgam fillings. A fun way that you can kind of get a sense of the age of those fillings. You didn't do them. The patient had them done years ago. Hey, Naren, do you remember who was president when those fillings were placed there in the lower left? Do you remember who was president? And if you say, I think it was Gerald Ford, right? Then I can say, I think you've gotten your mileage out of them. Again, I'm not exaggerating. That could be the answer. Could be
Yeah.
Ronald Reagan 40 some
Yeah.
years ago. Oh, I think it was Ronnie. It was Ronald Reagan that was president. I remember. Well, you've gotten your mileage out of them. So asymptomatic general, and the most obvious example would be old amalgam fillings that are clearly failing, but they don't hurt. And,
Right.
and your goal should be 70% or above. And then let's talk about ideal dentistry, ideal comprehensive care. Our goal is somewhere between 30 and 40% of ideal comprehensive care. Let me give you a comparison. I happen to enjoy baseball. My family is a baseball family. I love baseball. I love all the numbers and stats related to baseball. And if any of you follow baseball, you'll identify with this. What do they call a professional Major League Baseball player that had a lifetime batting average in the 300s? Let's say it was 369. They would call that Major League Baseball player a Hall of Famer. Yes. And what that means is they got a hit 36.9% of the time. They got a hit 36.9% of the time. That's what a 369 batting average means. And so in your case, so let's compare it to dentistry. When you're presenting ideal comprehensive care, if we achieve acceptance somewhere in the 30 to 40% range, you are doing really well with that. So now that we have benchmarks, let's kind of walk through some ways to improve your case acceptance. First of all, go ahead, Naren.
Gary. This is one of the questions, and I just want to preempt it. I think we all know inflation, right? It's all around us. People are cutting back. People are like tightening their budgets, right? Like I had a call with a client today, and she was telling me this. She used to do $100,000 pre-COVID, and now like they are postponing things. So how do you adapt this to 2024 June?
Well, I think it's important to recognize that at the time we're recording this, we are in a recession. Gas is more expensive than ever. Yeah. It's gone back up again to where it's back to all-time highs again in terms of gas. All this stuff often happens in a presidential election year, and we're likely to see more of it. And it's important to recognize that, for many people, their monthly budget is tight. But the key, one of the keys is to have truly a relationship-driven practice. Because when it's a relationship-driven practice, there's a factor that's already built in, and that's a factor of trust. And when trust is already there, when the patient knows, in their heart that you would only present to them what was in their best interest, then the case acceptance is likely to go up when they know that. And so we have to go back to being relationship driven.